Good day, my name is Jaethan Aldridge Nombrado, and I will be doing a report on the pregnancy-induced hypertension, or also known as hypertension during pregnancy. What is hypertension during pregnancy? It refers to having a high blood pressure that develops after 20 weeks of pregnancy and typically resolves shortly after giving birth. So it occurs approximately 6 to 8% of pregnancies. Um, the article emphasizes that there's a need for regular prenatal appointments to monitor blood pressure, as high blood pressure may not have presentable symptoms. So, moving on to the types of high blood pressure during pregnancy, there are three that are mentioned, which are the chronic hypertension, the gestational hypertension, and the preeclampsia. So, chronic hypertension usually is having high blood pressure before the pregnancy. So, before or early pregnancy. So, gestational hypertension is having high blood pressure at the latter part of the pregnancy, while preeclampsia happens after 27 weeks. Um, 27 weeks involves elevated BP and protein in the urine. So, of course, the blood pressure is elevated, and then when there are tests done and it's seen that there are protein in the urine, then that it is preeclampsia already. So, moving on to impact of the fetus inside the womb during hypertension. So, pregnancy increases the heart's workload. During pregnancy, a woman's body undergoes significant physiological changes to support the growing fetus inside the womb. So, one crucial change is the heart needs to work harder to pump the increased blood throughout the body, ensuring that both the mother and fetus gets adequate oxygen and nutrients. So, since it's not just the mother itself that's producing nutrients, there's also a baby inside. So, since there is a growing fetus inside the mother's womb, the heart needs to um, ex- uh, give more energy, pump harder, so that both the mother and the fetus inside gets receive adequate nutrients and oxygen. This increased workload of the heart is normally a necessary adaptation to support the demands of pregnancy. Uh, it also affects placental growth. Placenta plays a crucial role in pregnancy by acting a link between the mother and the developing fetus. So it's responsible for exchanging nutrients, oxygen, and waste products between maternal and fetal circulations. The proper development of functioning of the placenta are essential for a healthy pregnancy. Any disruptions or complication in the placenta, the development of the placenta rather, can impact the exchange of nutrients and oxygen, potentially leading to adverse outcomes of the fetus. So, moving on to the risk factors of having hypertension during pregnancy. So, age under 20 or over. Women who are 20 or over 40 years old are considered to be under 20 or over 40 years old, considered to be high risk in hypertension, pregnancy into hypertension. So, teenage mothers and women of advanced maternal age may experience physiological differences that can contribute to an increased risk in hypertension during pregnancy. These age group may be more prone to certain health conditions or may have less resilient cardiovascular systems, making them more susceptible to hypertension. So for uh, under 20 years old, their body is not fully developed yet, so they're not really ready for the pregnancy. So if if they have hypertension as well, and then they're still not over 20, then that may result to complications also. Same with women over 40 years old. Their body is not what they used to be, and then so if they're old and then they have hypertension also during pregnancy, so that may be a huge risk factor also. Then there's also the previous gestational hypertension or preeclampsia. So history of this means there's a history of gestational hypertension or preeclampsia. There's a risk of developing pregnancy, including hypertension, is subsequent pregnancies. So, women who have experienced these conditions before may be more predisposed to hypertension during future pregnancies, emphasizing the importance of close monitoring and medical care for those with a history of complications. Another risk factor is the family history. Uh, Having a family history of hypertension, especially during pregnancy, can elevate the risk of experiencing pregnancy-induced hypertension. Genetic factors may contribute to individual susceptibility to hypertension, and a family history of conditions can increase the likelihood of developing it during pregnancy. So, uh, it's hypertension itself could be possible through uh, family history. So, if one of your family members is hypertensive, it's possible that it may be passed to you, and you will be hypertensive too. So, if a pregnant woman, has a family history of hypertension, then it is possible that the factor that the woman is hypertensive during pregnancy is because of their family history. So diabetes or gestational diabetes is also a factor for hypertension. Well, in this case, um, it is diabetes itself is already a factor of hypertension, not just for gestational hypertension. So, if pregnant woman is diabetic, it may mean that it is a factor for their hypertension, or they are in risk in pregnancy-induced hypertension. Then another is the immune system disorders, such as the kidney disease. Conditions affecting the immune system or kidney function can contribute to the increased risk of pregnancy-induced hypertension. So disorders such as lupus or chronic kidney disease may affect the normal functioning of blood vessels and increase blood pressure, posing a higher risk during pregnancy. Then, expecting multiple babies is another one. When a woman carrying multiple babies, such as twins, triplets, etc., are at a higher risk of developing pregnancy-induced hypertension. So, I mentioned a while ago that the mother the heart of the mother has to pump or exage more energy for them to have nutrients for themselves and also for their baby. Well, if there are twins or triplets, this may mean that the heart will have to pump faster, since there are not just one of you, two of you, but there's three of you, since since it's the mother and then the two babies inside of her. Much more if they're triplets. So, if there are multiple babies inside the womb, so the mother must. It is expected for the mother to be hypertensive, since there is not just her that is the pump is giving up nutrients and oxygen with, but there is also the two or three babies inside of them. And I didn't know this before, but black ethnicity can be a factor also for hypertension, according to the article. So studies have shown that women of black ethnicity are at higher risk of developing pregnancy-induced hypertension compared to women of other ethnic backgrounds. The reason for this disparity may include genetic factors as well as socioeconomic and healthcare access factors that can influence overall health and pregnancy outcomes. Close monitoring and proactive management are particularly important for pregnant individuals of black ethnicity to mitigate the risks associated with hypertension during pregnancy. Now, moving on to gestational hypertension versus preeclampsia. So there is a difference between gestational hypertension and preeclampsia. For gestational hypertension, its timing is around typically, of course, the later half of pregnancy, usually after the 20th week. And then, unlike preeclampsia, gestational hypertension is characterized by high blood pressure without the presence of organ complications. So it does not involve damage to the kidneys, liver, or brain. The elevated blood pressure alone is a defining feature. In preeclampsia, is more serious and potentially life-threatening compared to gestational hypertension. So it can affect various organs, as mentioned a while ago, the kidneys, the liver, and the brain. And preeclampsia is characterized by high blood pressure and that presence of protein is in the urine, or also known as proteinuria. It can lead to damages of organs such as the kidneys, liver, and brain again. So, in the kidneys, it may cause renal dysfunction. For liver, could be hepatic impairment, and for the brain can result into seizures, known as eclampsia. Eclampsia. So, preeclampsia. Then, in preeclampsia, there is a risk for stillbirth. So, it's possible that if you have preeclampsia, then you deliver the baby and the baby is already dead. So, proceeding to symptoms of high blood pressure. So, these are symptoms of high blood pressure. There's also this called silent killer, which is asymptomatic. And then there is swelling, headaches, and sudden weight gain, vision changes, and nausea. So those are the symptoms of high blood pressure. Then dangers of hypertension during pregnancy. Um, so the dangers of hypertension are, as mentioned, seizures, stroke, temporary kidney failure, liver problems, blood clotting issues, and also higher risk for C-section. Then the impact of it for the fetus, as I already mentioned a while ago in the previous slides. So as mentioned also in the article, there is decreased placental blood flow that may lead to low birth weight, premature birth, stillbirth, and labor induction before full term. So these are normal blood pressure during pregnancy. So blood pressure measurement explained. So systolic and diastolic. Target is below 140/90, and in severe cases, over 160 to 110, and may require hospitalization, or if it's over 160 to 110. So diagnosis and tests. Regular blood pressure checks. So as a nurse, you must also do regular blood pressure checks. Depending on the doctor's orders, there are in some cases, if the pregnant woman has really high blood pressure, you have to monitor it every 30 minutes. But in common pregnant women, we on my experience on being on the OB ward or the OBER in SPMC, they let us monitor them every 6 hours. 6 hours. So when we get there, so 7, then 12, and then 3 p.m. is when we check their blood pressure. So additional tests if abnormalities are observed. So there is P in protein check to see if there is preeclampsia, swelling examination, and blood test for liver, kidney function, and clotting factors. So management and treatments. So these are examples of treatments for gestational hypertension. One of them is monitoring blood pressure, as I mentioned already also. So monitoring blood pressure is a fundamental aspect of managing gestational hypertension, because it involves measuring blood pressure at regular intervals during prenatal visits. This helps healthcare providers track changes in blood pressure levels and assess effectiveness of intervention. Then, medication. In some cases, healthcare providers may prescribe medications to control elevated blood pressure during pregnancy. Commonly used medications include antihypertensive drugs that are considered safe for use in pregnancy. The choice of medication depends on severity of hypertension and the individual's health status. I think there is losartan. I think it's losartan that it's a drug that can help you decrease your blood pressure, since its function to the body is it narrows, it rather dilates the blood vessels of your body. So since the blood vessels during hypertension usually are constricted, so if this is your blood vessel, for example, and then if the whole of if the diameter of your blood vessel is really constricted, that causes hypertension, because the blood flow is really fast, same as when you ipit the hose gani, while the water is flowing. So losartan, a drug, when you intake it, it will dilate the blood vessel inside, the blood vessel itself. So since it's constricted, when you take losartan, it dilates, that makes the blood pressure lower. So that is an example of medication that can be given to patients or patients with high blood pressure. I don't know if it's given, if it's, I'm not a doctor. I don't know if it's given to pregnant women, but I've I encountered that there is a prescribed medication losartan, and that is the drug study that I did, and that's why I knew its function. So yeah, and then hospitalization if necessary. In severe cases of gestational hypertension may require hospitalization for closer monitoring and management. So hospitalization allows healthcare professionals to provide intensive care, administer medications, and intravenously if needed. Uh, close monitor, Closely monitor the mother and the baby's well-being. And then frequent fetal health checks. So you have your ultrasounds, your non-stress test, and biophysical profile. For ultrasounds, this is imaging technique which help visualize the baby's development inside the womb of the mother. It also assesses the amniotic fluid levels and ensure proper blood flow throughout the umbilical cord. Then non-stress test. This test monitors the baby's heart rate in response to its own movements. Uh, a reactive NST non-stress test indicates a healthy baby. And then the biophysical profile. This combines ultrasound with an assessment of fetal movements, muscle tone, breathing, and amniotic fluid levels to prevent a comprehensive view of the baby. Moving on to steps for a safe delivery. So these are the steps of safe delivery. So first, you have to take prescribed medication. If there are any medication that the doctor has given you, you have to take it. If it's PRN, take it immediately. If the doctor says you have to take it at every 6 hours or after meals, then you have to take that also. Then, regularly check the blood pressure. As balik-balik na niya. Okay. If there are changes of blood pressure, then you can do something about it if the blood pressure is already high. Then attend all prenatal visits. So it's recommended for every pregnant woman to have prenatal visits regularly. So have checkups because you may not know if there are any complications already um, of your pregnancy. So you have to attend every prenatal visits as much as possible. Then follow healthcare providers' instructions on diet, exercise, and activity. So if the nurse or any healthcare provider, healthcare worker gives you health education, you have to listen to that because they know things and they just want to help you as a pregnant woman. So if there are any health education that they've taught to you, you have to listen to that, and then you have to do it also at home. It's not okay to just understand what they're saying and then not applying it at home or not applying it. So it's useless. The health education is useless if you understand them and then you what don't apply those health teachings. And then prevention of pregnancy-induced hypertension. So you have to maintain a healthy lifestyle. So there are regular exercises. There are exercises that are for pregnant women, and doing them can help regulate your blood pressure. And then avoid smoking and alcohol. This is smoking and alcohol may affect also your blood pressure. And then adequate rest. So if you're really stressed, it is a factor of hypertension. So if you have enough rest, then it regulates your blood pressure. And then baby aspirin if it's at risk. Moving on to the outlook prognosis for post-delivery. So hypertension usually revolves post-delivery. In many cases of gestational hypertension, blood pressure levels tends to return to normal after delivery. So the physiological changes associated with pregnancy, including increased blood volume and hormonal uh, fluctuations, typically subside postpartum. As a result, hypertension that developed during pregnancy often resolves without the need for continued treatment. And then increased risk for future hypertension and heart disease. Women who have experienced gestational hypertension are at an increased risk of developing hypertension in the future. Additionally, there is a recognized association between gestational hypertension and elevated risk of cardiovascular diseases such as heart disease and stroke later in life. Uh, Therefore, women with a history of gestational hypertension are advised to monitor their blood pressure regularly and adopt a heart healthy lifestyle. And then, postpartum checkup within 10 days if the hypertension is already severe. After delivery, a woman who had severe hypertension during pregnancy, especially if associated with conditions like preeclampsia, are typically recommended to have a postpartum checkup within the first 10 days. This checkup is crucial to monitor blood pressure levels and assess overall health of the mother as they transition into the postpartum period. Early detection of management of any lingering hypertension or complications are essential for the well-being of the mother. And then, when would you worry? Uh, you seek medical attention for sudden headaches, blurry vision, swelling, and reduced urine. So, if you have these symptoms, that's the time you have to worry. That's the time you seek medical attention. And then you communicate with healthcare providers about your concern. Don't be afraid to tell the nurse, the doctor, or any healthcare provider or healthcare workers about your concern, because that's their job, that's their duty. If you're a pregnant woman and you have questions about should I worry about this or that, you have to have the courage to talk to healthcare providers. That's the end of my presentation and that's everything that I've read also in the article. Thank you.